There's a warning this morning from the World Health Organization giving new official advice on how quickly COVID-19 can spread through the air.
To discuss, we're joined by Dr. Margaret Harris from the World Health Organization. Margaret, always good to talk to you. Didn't we already know that coronavirus was spread through the air?
Yes, indeed we did. And so it's been characterised as new advice, but what actually we did was update question and answer for the public so that people could understand the different means of spread. And one of them is that you can produce little aerosols, and if you're talking, shouting, laughing at close quarters in a closed space with poor ventilation, then that sort of spread can happen. So, we've had this discussion over and over, haven't we? Keep outdoors whenever possible. If you're going to be with other people, don't get into those crowded situations indoors.
I suppose that this advice is part of the other advice that was that the Indian variant could be dodging vaccine protection. What exactly do you mean by that?
So when we look at these different variants, it's one of the things we look at, what you call immune escape. And that's when you've been sick with the virus already, and then a variant comes along and you get sick again. And we've seen this, for instance, in Brazil. But also we look at whether the vaccine, the antibody it produces, is not effective against the variant. Now, so far we're actually seeing that the vaccines are effective against the variants that we're tracking, but we watch them all because, of course, if you do see that, then you need to start tweaking your vaccines.
I mean, just looking at these new milestones that India has reached over the weekend with more than 4,000 deaths, another 400,000 cases, do you think we've seen the peak of it yet?
I do not expect so, in that with such a large outbreak and such a large country, and we've got outbreaks in different parts of the country, unfortunately this virus has got a lot of burning to do.
And on that, given that hotel quarantine and the fresh advice that you have this morning about this variant able to move and how it moves, hotel quarantine, do you think that's still safe, or is there should there be more of a push to these special centres out of towns?
Certainly supported quarantine is the best way to go, but you have to look at whether you can indeed ensure that people are not mixing in any way, and that's not easy. So if you can really be sure that you can separate people well, support them and get them through that time, that is a really effective way to prevent importing the virus into your population.
Do you think you can do that in a hotel situation?
It has been done. It has been done in quite a lot of countries, but it's got to be well managed, and you've got to make sure people really are not mixing.
There seems to be a delay in when the world's going to open up again. When do you think it's realistic that everyone will start travelling again to different countries?
It's going to take a while because, okay, some countries like Australia and New Zealand have really kept their transmission low, but even so, there have been hiccups with trying to get the bubbles going, the travel bubbles going. Now, when you've got huge transmission, and remember we're seeing the highest numbers we've ever seen, and we're seeing worldwide, we're seeing numbers in a week that it took 5 months, 6 months to reach at the beginning of this outbreak. So, with that kind of intensity, the idea of simply travelling all over the world isn't really a safe thing to be doing right now.
How long do you reckon? I don't think you answered it, Margaret.
Next year?
I haven't got a date. But it can be as quickly as we all bring down the transmission. So one of the critical things is really getting the vaccines into arms equally all around the world. So that's crucial. And again, Australia and New Zealand have really been helping, sharing doses with neighbours and so on. But also we as World Health Organization, but also we as the world, really have to be serious about the public health social measures to bring the transmission down while getting the vaccination up. I know I say this every time, but it does work. Lots of countries are showing it, but we need all of us to do it.
All right.
It's an important message. Margaret, thanks for joining us this morning.
Thanks,
we always
Margaret.
appreciate it.